happening with healthcare this year?
There's a lot happening with healthcare this year. We have to get our state ready to implement the Affordable Care Act, which will expand healthcare greatly across our state. It will provide healthcare for nearly every person that lives in the state of Washington. I'm very excited about it, but at the same time, it's really complicated. Right now, we are putting together what's called the exchange, which is the process that allows folks to be able to buy the affordable health care. And you can imagine it's controversial, and it's going to take a lot of mediation and a lot of compromises to get it done, but I'm sure we'll be able to do that this year.
Who are we trying to cover now that doesn't have health coverage?
Right now, the biggest group of folks that aren't covered are the working poor. So in other words, folks that are working and would like to have health care, but there's just nothing available to them from their employer, or what's available on the market is just too expensive for them. When they pay their rent, their food, their clothing, there's nothing left for health care. That's the group we really need to get insured.
So if you have a job, we want you to have health care.
Right. You know, if you're playing by the rules and you're doing everything that you can, we want to make sure that you're able to be healthy. You know, for one thing, that's going to help our entire community because colds know no boundaries. You know, if I have a cold, I can spread it around to anybody, right? And so we want to make sure everyone's healthy. It'll help the entire state if we're all healthy.
Which bills are you working on specifically this year?
I have a couple of bills that I'm working on this year. One that I'm really excited about is my long-term care bill that allows certified nurse assistants to pass medicines in nursing homes under the supervision of an RN. Now that sounds really technical and boring, but it's an exciting bill because, you know, everyone's familiar with the large amount of folks that are getting older, the baby boomers as they're called. And as the baby boomers retire, we're going to have more and more people who need health care. We have a huge healthcare worker shortage coming our way, and we have to do everything we can to make sure we have enough providers. So what this would do is allow a certified nurse assistant to get some extra education to learn how to pass medicines. In other words, just the mechanical act of giving someone their medicines. The nurses would still do the assessment to make sure the patient was responding to the medicines appropriately and that they were getting the appropriate care in regards to other needs, but it would allow the certified nurse assistant to do this. It would give the certified nurse assistant a way to have maybe a wage ladder, a progression, so that they might actually go on and become nurses themselves someday. One of the problems we have in the healthcare field is when folks go to high school and then they go to college to be a nurse, they quit after a period of time because they figure out that maybe they didn't like that environment or taking care of ill people. And where we have a better idea of recruitment and retention, a better outcome of recruitment and retention and keeping healthcare workers in the healthcare field is when we take folks that are perhaps doing the cleaning or doing the dietary things, doing the hands-on certified nurse assistant care, and we grow them through the system. They're much more likely to stay because they were drawn to work in that field anyway, and they sort of already know the ropes. So it really is a win-win. We have a little bit of conflict between some of the nurse groups, and we want to make sure we get it right. They already do this in Oregon, and we want to not only learn from them, but do it better. So I'm really excited about this bill. I think it'll get all the way through the process this year, and it'll really help provide more access to care, increase the quality of care for our baby boomers as we're getting older.
What's happening with the pain medication problem?
A few years ago, we passed a bill that had to do with pain medication and the amount of pain medication that could be prescribed to any one person at a time. You know, we have a problem in our state of having overdose of prescription pain meds. We're one of the highest in the death from overdose of prescription pain meds. So we put some limits on the amount of pain medicine that could be prescribed, and also some education for doctors. Sometimes we don't always get it right. And what has happened with this is that many doctors have decided just to stop prescribing chronic pain medication. Now that's been a problem. So I put in a bill that would put a hold on all the rules that we made so we can take a greater look at the problem. I'm not sure the bill's going to get through the committee, but what I have been able to do is get the attention of enough people to have a work session scheduled. And so we're going to bring in doctors, we're going to bring in patients, we're going to say, hey, what's going on here. Certainly we want the goal of not having accidental overdoses from prescription pain medications, but we also see a real need for people with chronic pain from things like multiple sclerosis and other kinds of musculoskeletal diseases to get the relief they need and not to be told that they can't see their doctor anymore. And in many cases that's happening. They're going to their regular doctor they've seen forever, and their doctor says, sorry, I can't do your chronic pain management anymore. That's a real problem, and that's never what we intended with the bill. So we're going to keep working on that. I especially need to hear your stories. If there's any of you out there that are experiencing this problem, or you have friends or family that are experiencing this problem, I really need to hear from you on this issue and on any other issue. Your stories are very important to me, and that's how I can come up with the ideas to make things better for all of us. So I'd love to hear from you.